Hello, my name is Axel Gräwingholt. I would like to share my experience on how ProFound AI is used in clinical routine for breast screening and diagnostics. First, I would like to introduce our imaging facility in Paderborn. My name is Axel Gräwingholt. I'm a radiologist specialized in breast imaging and co-owner of a private institute called Radiologie am Theater. It is a private imaging center, as I said before. We serve about 80,000 patients per year and have 70 employees. 5 radiologists of our units are specialized in breast imaging. 3 are working in the breast cancer screening unit. We are running a screening unit for the German official breast cancer screening program. And we are the first institute in Germany to use ICAT's entire ProFound AI platform. Now, which solutions do we have about AI for breast imaging? ICAT provides us with PowerLook 10.1 platform, which consists of a detection solution for tomosynthesis, a detection solution for 2D mammography, a breast density classification tool, and very new, a risk evaluation tool. How does ProFound AI work? ProFound AI uses several scores, one of which is the lesion score. The lesion score represents the algorithm's confidence that a detection is malignant. Each detection lesion has a score. The lesion scores are represented on a 0 to 100% scale, and the results may be slightly different depending on the view in CC or MLO. This percentage guides the radiologist in his decision-making. He or she will decide whether the finding is considered suspicious of further examinations. On the left, you see an example from a 3D study. Now, ProFound AI also uses K-scores. It uses calibrated case level scores from 0 to 100%. These are computed by aggregating information from all detections within the case, and it represents the algorithm's confidence that the case is malignant or contains a malignancy. All cases are assigned a score, even if no visibly marked detections are there, and the score is calibrated to a large ICAT database of case detections and designed to assist the radiologist's clinical decision-making. The breast cancer risk assessment is based only on a mammogram and age. It's based on 2D FFTM. It is multi-mammographic features based on density, texture, shapes and patterns, asymmetries and calcifications and masses, plus age, which we already have in screening and diagnosis. It gives you a near-term 2-year absolute risk score for the woman to be diagnosed with breast cancer within these 2 years. And it has superior accuracy versus commonly used risk models like Tyrer-Cuzick or Gale. This new information empowers clinicians to truly personalize patient care and follow up depending on the patient's risk. I would like to present to you the use of ProFound AI on a case study illustration. The patient's history was a 73-year-old woman came for opportunistic screening in October 2020 before she went to the screening program regularly in 2009, 11, 13, and 15. The next screening with regular interval would have been in 2017, but the woman turned 70 in 2017, so did not get invited. In October 2020, she came without symptoms for routine diagnostic mammography, opportunistic screening, choosing to opt for 3D mammography on her own expenses. I would like to show you the evolution of the lesion in the CC view. First, from 2009 to 2015, where we retrospectively then applied all the algorithms ProFound AI gave us to demonstrate how it works. Now you see all images with the marked lesion, where the lesion score went up from 33 to 36 to 48 and 50% over the years. I show you the same in the OBL images. The lesion on the right side at 12 o'clock is a well-rounded lesion, which was dismissed by the radiologist because it didn't have any changes to the priors. And when we applied ProFound AI retrospectively, we could see that the lesion scores and the K-scores here did go up over the years, moderately increased from 36 over 38, then to 58 and to 99%. Now, tomosynthesis of 2020 read with ProFound AI showed a lesion on the right side at 12 o'clock. It was well marked and the lesion score was 86 in the CC and 80 in the MLO, and the K-score overall was 98. This was at the time of diagnosis. Histopathology results showed there was an invasive ductal cancer next to mastopathic tissue, which is displayed in pink. The cancer is displayed in purple. The mammographic images of 2013 and 2015 probably masked the tumor for the radiologist because of superposition of the benign lesion. ProFound AI already detected the subtle changes to this area and assigned higher lesion scores and a higher K-score. When retrospectively applying ProFound AI risk, we could see that the risk increased gradually from 2009 to 2015 and went from moderate to high in 2013. In this chart, you can see all the K-scores, lesion scores, and risk scores over the years, how they developed. And what you can clearly see is that all scores went up gradually every time the woman came for a screening, and also, of course, when she came for her diagnostic mammogram. The graph on the right side shows you how a risk developed in the years between 2011 and 2015. The blue line demonstrates the average risk of a woman of this age group, and the green line demonstrates the individual risk of the woman, which increased very high from 2011 to 2013 and from 2013 to 2015 again. So what is the conclusion? If in 2013, because of the high ProFound AI risk score, supplemental screening, for example, ultrasound, CSM, or MRI would have been added, there is a high probability that a very small cancer could have been found. If in 2015, because of the high scores both in ProFound AI risk and ProFound 2D supplemental screening would have been added, the cancer would have certainly been discovered. In 2020, 5 years later, the diagnostic exam with ProFound 3D revealed the correct lesion with a very high K-score and a very high lesion score. Invasive ductal carcinoma was confirmed by the histopathology report. In this example, the cancer diagnosis would have been detected 5 years earlier in 2015. Optimally, it could have even been detected 7 years earlier in 2013 if ProFound AI and ProFound AI risk would have been available, applied, and used as a decision tool for supplemental screening. Thank you very much. For further inquiries and information, please go to ICAT's website.